It seems like alcohol and cancer are everywhere in the news lately.
Yeah.
Makes you wonder if it's something, we should be taking a little more seriously.
Mm-hmm.
So today we're going to do a deep dive. We have a ton of research articles,
Right.
news reports, expert opinions, all about this topic.
Mm-hmm.
And you've shared some really interesting stuff with me. So let's jump right in.
Okay.
I'm curious to get your take on this whole thing.
Well, it's definitely something that needs attention. And what's interesting is it's not like this is brand new information. The World Health Organization has actually been talking about this for years, and they classify alcohol in the same category as asbestos and radiation.
Wow.
Yeah.
That's serious stuff.
It is serious. It's really serious. And we're talking about, what, 20,000 U.S. cancer deaths each year?
And that's just from alcohol.
Just from alcohol, just from drinking.
So we're talking about alcohol being a group 1 carcinogen.
The highest.
Yeah.
The highest risk group there is.
So what does that actually mean for people listening? Like, what's that doing in our bodies?
Well, it means that there is a proven link between alcohol and certain cancers.
Okay.
And when we say certain cancers, it's not just one type. We're seeing gastrointestinal cancers from your mouth all the way down to your colon and rectum.
Okay.
Larynx cancer, liver cancer,
Yeah.
and in women, breast cancer as well.
Okay, so a whole range.
The whole range.
Yeah, it makes you think twice about that, everything in moderation.
Absolutely. And here's where it gets interesting. It doesn't matter if you're drinking beer, wine, or liquor. We're talking about the alcohol itself.
So a shot of liquor is worse than, like, a light beer.
Exactly. Higher alcohol concentration equals higher risk.
Okay.
No getting around that.
So much for that healthy glass of red wine. We'll get into that a little bit more.
We will.
But one of the things I wanted to ask you about, because we've been hearing about this a lot, is this alarming rise in cancer rates in younger adults.
Yeah.
And it seems like, we're always told cancer rates are going down.
Right.
So what's going on with that?
Yeah, it's a worrying trend. And while there's more research needed, a lot of experts are pointing to lifestyle factors.
Okay.
And alcohol consumption is a big one. The American Association for Cancer Research estimates 40% of all cancer cases are linked to things we can control that includes alcohol.
Right.
So, yeah, it's definitely something to pay attention to.
And drinking habits might be changing, right?
Absolutely. For example, we have Dr. Overstreet, a leading expert in geriatric health. He points out that people 65 and older account for 38% of alcohol-related deaths.
Wow.
And it's this age group that's increasingly drinking regularly. So we need to understand what's influencing these trends.
So we're seeing these trends, but I'm still stuck on this whole moderate drinking thing.
Yeah.
Especially for your heart, right? Like, we've heard that for so long, a glass of red wine a day. What does the latest research tell us?
It's so interesting that you say that because there was a really large UK study. They followed over 135,000 older adults.
Okay.
And they found no heart benefit.
Really?
For light to moderate drinkers compared to people who only drank occasionally.
So even that one glass of wine a day is kind of misleading?
It seems that way.
Yeah.
In fact, they actually found that those moderate drinkers, they had higher cancer mortality rates.
Oh, yeah.
Yeah. Okay. Well, that's pretty clear.
Yeah, it is. And frankly, there are so many better ways to support your heart.
Right.
Exercise, diet,
The tried and true.
Yeah.
Okay, so we're putting that myth to bed.
Yeah.
But the thing that I'm getting a little tripped up on here is it sounds like everybody's risk is really personal.
Oh, absolutely.
Right. It's not like a one-size-fits-all.
It's so individual.
Yeah.
It depends on how much you drink, how often you drink. Even at low levels, there's still a risk.
Yeah.
And then you've got genetics.
What do you mean?
Well, some Asian populations, for instance, they have a genetic variant that makes them more sensitive to the harmful effects of alcohol. So their cancer risk is higher. Oh, interesting. So it's like your body's own instruction manual kind of influencing how it handles it.
Exactly. We don't all process alcohol the same way.
That's really fascinating. What are some other things?
Your overall health.
Okay.
If you have any existing health conditions like liver problems or high blood pressure, alcohol is only going to make those worse.
Right.
And it can really mess with your medications, which is something Dr. Overstreet really emphasized, especially as we get older. We're more likely to be managing multiple things at once.
Right. Like adding fuel to the fire.
Exactly.
Yeah. What about socioeconomic factors? Do those play a role?
Huge role. People from lower socioeconomic backgrounds are unfortunately at greater risk.
Okay.
Less access to health care, healthy food options. They may not even get the right information about alcohol. It's a much bigger issue than just what we choose to do on our own.
So it's how much we drink, it's our DNA, It's our overall health. It's, almost these social determinants of health as well.
It's complex.
It's complex, yeah. And I think it's really important, for people to understand we're not like judging anybody's choices here. It's really about empowering people with knowledge.
Absolutely. This is about giving you the information to make the best choices for your own health.
Yeah. So if someone's listening to this and maybe rethinking their relationship with alcohol a little bit, what can they do? Where do you even start to make a change like that?
Well, the great news is reducing or eliminating alcohol is one of the biggest things you could do to lower your cancer risk.
Okay.
Right up there with not smoking, healthy diet, exercise.
Okay.
And it's never too late.
Okay, that's good. So even if you've been, drinking for years and years, like cutting back can still make a difference.
Absolutely. There was some research out of CU School of Medicine that found that people who cut back or stopped drinking could reduce their risk of alcohol-related cancers by 8%, which is huge.
Yeah.
And even better, their risk of all cancers went down by 4%.
Wow, that's amazing. That's a lot.
Yeah, that's significant.
Yeah. That just shows you how much power we really do have. It really feels like you're taking control of your health destiny. And it sounds like this is even more important for, older adults. Minimizing alcohol as you age, especially with those health conditions.
Absolutely. Our bodies just become more sensitive to it.
Yeah.
The older we get, risks are higher.
Mm-hmm.
It's just not worth it.
One thing that I keep coming back to, and maybe you can help me out here, is we've said over and over again, it's the alcohol itself.
Right.
Doesn't matter if it's beer, wine, liquor.
Right.
But then why is there this thing about red wine? Like, why does that myth persist?
It's a great question. I think, honestly, part of it is just marketing.
Yeah.
Think about the image of red wine, right?
Yeah.
Sophistication, maybe a little luxury.
Yeah.
It's easy to see how that bleeds over into the health conversation.
Yeah, like a health halo or something.
Exactly.
Yeah.
Plus, there has been some research, but, a lot of that has been challenged.
Okay.
Showing correlation, not causation, really.
Right. So it's kind of buyer beware when you see some of these headlines.
Oh, absolutely. Be critical.
Yeah. Well, this has been, really eye-opening, and I think it's so important, like you said, knowledge is power. So for anyone listening, if you want to learn more about this, we're going to link some of those resources
Yes.
in the show notes. But I think most importantly, talk to your doctor.
Please do.
They can give you the best advice for your own personal situation.
Absolutely.
This is a conversation to have. So thank you so much for all of this. This was fascinating.
It was my pleasure.
And for everyone at home, we'll catch you next time for another deep dive.